Look at epidemiological studies, what they are, a few different types of studies, their advantages and disadvantages. First of all, what is a study? Well, simply put, a study is a scientific process of answering a question using data from a population. It can be any question. For example, does smoking cause cancer? Is there more disease in an area compared to another? Or what food is responsible for causing an outbreak? So the first thing to do in any study is to have a study question. What are we trying to find out? Then, we need to figure out what the best type of study is that would help us answer the question. Once we've decided on a study type, we need to do the study, collect and analyze the data using a suitable statistical method. Then we need to interpret the results to make sense of it all. And finally, we need to report the results of our study. Importantly, all studies need to be done in an ethical way. Now let's have a look at a few different study types. An ecological study is a type of study where measurements like disease rates and information about exposures are made on a group of people. The groups can be as small as people in a house or as large as people in an entire country. It's important to remember that results and conclusions from ecological studies apply to a group and not to individuals. Ecological studies are useful for comparing the health of populations in different places, such as measles rates in Australia and New Zealand, or at different times. They're also useful for generating questions and highlighting issues that can lend themselves to future investigations or studies. A case series describes the characteristics of a group of people who have the same disease or the same exposure. The aim of this is to understand the demographics, clinical presentation, prognosis, or other characteristics of people who have a particular disease, or describe something unusual. For example, in the early 1980s, the occurrence of an unusual pneumonia in men led to the recognition and identification of HIV. A cross-sectional study takes a selected population and measures health information at a given point in time, giving a snapshot of their health. It usually involves asking participants a series of questions using a questionnaire. Health surveys that collect health information about people in a population is an example of a cross-sectional study. Because these studies commonly measure how many people have a disease at a particular point of time, they're also called prevalence studies. It's important to make sure that the selected population is representative of the total population. Cross-sectional studies are relatively inexpensive and easy to conduct compared to other studies. They can provide information on multiple exposures and outcomes and are a good way of assessing the health needs of a population. However, because the information is collected at a single point in time, it cannot be used to determine whether a particular exposure caused the disease or not. A case control study starts off with cases. These are people with a disease. It uses a comparison group called controls, who are similar to cases but do not have the disease. Then both groups are asked about their previous exposures to different risk factors. Now, for each of the risk factors, the odds of being exposed if they were a case is compared to the odds of being exposed if they were a control. This is called an odds ratio. An odds ratio of more than 1 means that people with the disease are more likely to have been exposed to that risk factor than people without the disease. This suggests that it could be a possible cause of the disease. An odds ratio of less than 1 suggests that it's a protective factor, and 1 suggests no association. Case control studies are commonly used in food-borne outbreak investigations. For example, we can compare the odds of eating different kinds of food between people who fell ill after consuming a meal and those who didn't. If the odds ratio is greater than 1 for a particular type of food, then it's possibly the cause of the illness. A major advantage of a case control study is that they're often quick and cheap to do. Also, because they start off with cases, it can be used to study uncommon diseases. However, because these studies involve small numbers, they're not good to study rare exposures. One of the challenges in a case control study is to find suitably matched controls. Also, because studies ask about exposures in the past, people might not be able to recall their exposures accurately. Let's have a look at cohort studies now. In a cohort study, a group of people is followed over a period of time to see what happens to them, and information about risk factors is collected. We can then compare the occurrence of an outcome, like disease, in those who were exposed to a particular risk factor to those who were not exposed to that risk factor. The main measurement used in cohort studies is called the relative risk. A relative risk is the ratio between the risk of disease in the exposed group compared to the risk of disease in the unexposed group. A relative risk of greater than 1 means that the exposure is associated with an increased risk of the disease. If it is 1, it indicates that the risk is the same, and if it's less than 1, it indicates that the risk is lower. A well-known cohort study is the British doctor study, done in the 1950s, where a group of doctors were followed up for many years. This study provided valuable scientific evidence of the harmful effects of smoking, especially the link between smoking and lung cancer. One of the main advantages of cohort studies is that the time sequence of events can be determined. This is useful when trying to determine what caused a disease. Another advantage is that information about several different outcomes and risk factors can be collected at the same time. This allows for sub-analysis to be conducted on the data. A disadvantage of cohort studies is the high cost, as they can involve a large number of people being followed over a long period of time. They're generally not suitable to study rare diseases. A challenge in cohort studies, especially ones that are conducted over a long period of time, is ensuring that people who started the study stay until the end of the study. If many people drop out, it will affect the results of the study. Now let's look at another type of study, an interventional study. In an interventional study, an intervention is done on a group of people and the outcome studied. Examples of interventions can be giving a medicine, a vaccine, or health advice. The outcome can be things like a change in disease status or change in behavior. A randomized controlled study is the best study design for an interventional study. Say we want to study the effects of a new drug. We start off with a study population. People are then randomly allocated to be in the intervention group, where they receive the drug, or in the control group, where they don't receive the drug. Then, after a suitable time period, the outcomes in the two groups are assessed and compared to see what effect the drug had. Outcomes can be things like a change in disease, symptoms, or death rates. Ideally, neither the participants nor the investigators should know which group received the intervention. This is called double blinding and ensures that neither of them can influence the outcome of the study. The main advantage of a randomized control study is that it can provide good evidence that the intervention led to an outcome. Randomization ensures that both groups have an equal chance of receiving the intervention and that they have similar characteristics. This way, the effect of the intervention can be determined without other factors influencing the outcome. The disadvantages are that these studies are generally quite expensive to do. It may also require a large number of participants. It may not be suitable in some situations where not giving an intervention may be inappropriate or unethical. Finally, sometimes it's hard to keep up with all the studies that have been done on a particular topic. But thankfully, there are studies that summarize other studies. There are two main ways that this is done. A systematic review systematically identifies all the relevant studies on a particular topic, assesses the quality of each study, synthesizes and interprets the findings, and presents an impartial, unbiased, and balanced summary of the evidence. A meta-analysis uses data from all the studies that have addressed the same question and have a similar study design. It then uses the data from these studies to do a combined statistical analysis and produces a single summary result. And that's an overview of some of the commonly used epidemiological study types. We've had a look at what a study is, different study types, their advantages and disadvantages, different types of surveillance, and look at what makes a good surveillance system. Surveillance is defined as the ongoing, systematic collection, analysis, interpretation, and dissemination of data regarding a health-related event for use in public health action to reduce morbidity and mortality and to improve health. Historically, surveillance was mainly used to monitor infectious diseases. However, it can be used to monitor any health-related event, such as chronic diseases, injury, health services uptake, vector distribution, or environmental hazards. Surveillance can be thought of as the eyes and ears of public health. The information gained from surveillance can be used for characterizing the patterns of disease, detecting outbreaks, suggesting hypotheses for further investigation, identifying cases for further research, guiding disease control programs, setting public health priorities, or evaluating health programs. Surveillance systems have a few basic elements. First is the way of detecting health events and notifying them. This is usually done by a health service or laboratory. Then the information needs to be collected and stored in a systematic way. This data then needs to be analyzed and interpreted. And finally, this information has to reach the right people so that appropriate action can be taken. So now, let's have a look at a few different types of surveillance. Passive surveillance describes the routine reporting of health data. Let's have a look at some examples. In most countries, there are a number of diseases or conditions that are required to be notified by law. Surveillance of these notifiable diseases rely mostly on a passive system. Another example is a registry, which is a collection of health data. Registries can have data on births, deaths, cancer, chronic diseases, and a variety of other diseases. Healthcare providers like hospitals also routinely collect data on the number and type of patients that seek treatment. This is another example of passive surveillance. Passive surveillance is a valuable source of health information. One of the biggest advantages of this type of surveillance is that it's generally inexpensive. It can be used to provide baseline data on the health of a population, monitor trends, or monitor the impact of an intervention. Also, different types of these data sets can be linked to provide a complete picture of health. There are, however, a number of limitations of passive surveillance. The main one is underreporting. Diseases can be underreported because people have mild or asymptomatic illness and don't seek medical treatment for their illness, or there's a lack of access to treatment. It could also be because laboratory facilities needed to diagnose a disease are not adequate, or that there are logistical problems with reporting disease. In fact, there can be a lot of variation in passive surveillance systems from country to country, which is a reflection of social, economic, cultural, and epidemiological factors. Now, let's take a look at active surveillance. In contrast to passive surveillance, in active surveillance, health data is actively sought out. This type of surveillance is commonly used during outbreaks. For example, during an outbreak, health teams may visit the community to actively seek out cases that may not have otherwise presented to health centers. Another example of active surveillance is serosurveillance. This involves testing blood in a selected population for various markers. For example, checking for antibodies can be used to check for active or past disease. Health surveys are also a good example of actively seeking out health information. Surveys can be done on community members, healthcare facilities, or entire countries. They can be done on an as-needed basis or regularly. Active surveillance provides more complete and better quality data, but is more resource-intensive. Another type of surveillance is sentinel surveillance. This type of surveillance uses selected institutions or groups to provide health data on specific diseases or conditions. It can be useful for monitoring diseases, trends, and detecting outbreaks. A disadvantage of sentinel surveillance is that because it's restricted to a few institutions or groups, it cannot detect events that happen outside these. Therefore, it's not that useful for rare or uncommon diseases. Another form of surveillance that's becoming increasingly useful in today's interconnected world is rumor surveillance. This type of surveillance relies on unofficial sources of information like blogs, internet discussion groups, media, hearsay, and social media sites. Rumor surveillance can alert public health authorities to incidents or events that require further investigation and can lead to early detection of disease outbreaks. The next type of surveillance is syndromic surveillance. This involves monitoring non-specific syndromes like presentations for fever, respiratory or gastrointestinal illness, or other indicators that might highlight illness, like the purchases of medicine or absenteeism from work or school. The aim of this is to allow early identification of clusters of illness before diagnoses are confirmed and reported to public health agencies. Syndromic surveillance usually relies on automated electronic methods. There are other types of surveillance systems as well. For example, ProMed is a website that puts together reports of disease events, and the Global Public Health Intelligence Network is an internet-based early warning tool that uses an automated process to monitor online news sources for diseases or significant health events. While there are many different surveillance types, each with its own advantages and disadvantages, an integrative approach using all sources of information provides the best overall picture of health. Okay, now we've had a look at different types of surveillance systems. Let's have a quick look at what makes a good surveillance system. Firstly, a good surveillance system must have clearly stated objectives and have a good system to ensure that these objectives are achieved. Other characteristics include simplicity. It should be easy to operate and have straightforward case definitions that are easy to apply. It should be flexible to accommodate changes in information needs or conditions in which it operates with minimal additional resources. The data should be complete and accurate and be of good quality. It should be accepted by people and organizations participating in surveillance. It needs to have a good sensitivity and positive predictive value. It should pick up most, if not all, cases of the disease that exists in the population. Surveillance data should be valid, meaning that it measures what it intends to measure. The system must accurately represent the occurrence of a health event in the population that is being studied with regards to time, place, and person. It must detect health events in a timely manner so that authorities can take appropriate action. The resources involved in running the system, both human and material, must be stable and available when needed. It's also important that surveillance systems are evaluated routinely to make sure that they continue to meet their objectives and that they're serving a useful public health function. And finally, surveillance isn't just about monitoring health events, but providing useful information to enable public health action. So that's an overview of public health surveillance. We've had a look at what surveillance is, different types of surveillance, and characteristics of a good surveillance system.